Good afternoon, everyone. Thank you so much for joining us today for the talk with a brilliant title, Protecting the Brain While Healing Hearts. So we're very excited about this. My name is Dr. Angela de Bruin. I'm a senior lecturer in the Department of Psychology at the University of York. And before I introduce our fabulous speaker for today, as always, just a couple of housekeeping notes. So you'll have subtitles available for this event if you want to turn them on or off. You can use the CC Show Captions button at the bottom of your screen. If you are watching live with us today, you can ask questions using the Q&A button again on your screen. Now, this will be available throughout the entire event, so just type your questions anytime you want, and then we'll see them and we'll ask them after the talk itself. As you hopefully know already, the event today is being recorded, so you will be able to watch it again later as many times as you want after the event itself. So it's a great pleasure today to have with us Dr. Kalliopi Megari. Now, the event itself is presented in collaboration with City College, University of York Europe campus, and Kalliopi is the academic director of the postgraduate program in clinical psychology at City College. Kalliopi is also a postdoctoral researcher at Aristotle University of Thessaloniki and an adjunct lecturer at the University of Western Macedonia in Florida, so keeping herself very, very busy. Kalliopi's background is in nursing and psychology, where she got her undergraduate degrees, and then a master's and a PhD in neuropsychology from Aristotle University of Thessaloniki. Currently, she's a global membership committee member of the International Neuropsychological Society, and she's also a leader of the rehabilitation of COVID-19 patients working group of the Neuro-COVID International Neuropsychology Task Force. Her work is really well known and has earned her many, many prestigious international awards, as well as various leadership roles. She was an ambassador of the National Academy of Neuropsychology, and she was also on the USA Leadership and Ambassador Developmental Program. So today, we're really, really pleased to have you here with us, Kalliopi. We're really looking forward to your talk. Kalliopi will be telling us all about how specialized brain training programs can boost recovery and quality of life after heart surgery. So Kalliopi, thank you so much for joining us, and over to you.
Hello, I'm very excited to be here with you today, sharing my research and my knowledge regarding neuropsychology and cardiac surgery. Thank you very much, Angela, for the introduction. You seem to know everything about me, but I will share some more regarding my background, a few more things. I used to be the head of the Center of Creative Activities of Children with Disabilities, Municipality of Kalamaria in Greece. I was research fellow at the Cardiothoracic Department of Cardiothoracic Surgery, University General Hospital of Thessaloniki HEPA, when my research was conducted. I'm editor-in-chief of Journal of Psychiatry and Mental Health, and I'm a General Secretary of Board of Directors and Ethics Committee President of Hellenic Neuropsychological Society. A few more things about it. So, before I start my research, let me introduce you my city, and I will say a few things about my university. Thessaloniki is the second largest city in Greece. Its nickname is the co-capital, a reference to its historical status or co-reigning city of the Eastern Roman Byzantine Empire alongside Constantinople. Thessaloniki is Greece's second major economic, industrial, commercial, and political center. It's a major transportation hub for Greece and southeastern Europe, notably through the port of Thessaloniki. The city is renowned for its festivals, events, and vibrant cultural life in general, and is considered to be Greece's cultural capital. This is my city, Thessaloniki. You should come for vacations. It's a beautiful city, and these are the historical monuments of the city, which are by the sea. Now, let me tell you a few things about my university, City College of Thessaloniki. City College University of York Europe campus offers a range of undergraduate and postgraduate programs in the fields of business studies, computer science, psychology, and humanities in the region of Southeast and Eastern Europe. And the majority of the programs are offered at City College's main campus in Thessaloniki, Greece, while a number of programs are also offered in other locations across the region. Now we are going to be the non-public, one of the first non-public universities, and we are very happy about it. Now, I will start my research, and I shared this picture to show that the brain and the heart is very well connected, and they have a very important connection between them. I could say they are best friends. So, heart and brain, when we experience a positive emotion, when we feel sad or we feel that our heart can break out of sadness, which organ can we say that handles this emotion? The heart or the brain? Or both of them? So heart beats at a different rate depending on the emotions we feel, but it's the brain that has the control. Heart and brain have a dynamic relationship with a strong connection that includes a lot of different conditions. And the scientific study of the heart and brain began with Greek philosophers, of course, and extend to neuropsychology and psychocardiology. Psychocardiology is the field of psychology that has to do with the study of heart and cardiological conditions. Patients with heart disease often suffer from psychological comorbidities. In addition to various physical impairments they have, these mental disorders reduce the quality of life and have a negative effect on the development and course of heart diseases. So heart and brain are strongly connected to each other, and heart injury leads to dysfunction of the brain with a lot of cognitive impairments. Communication between the heart and brain actually is a dynamic, ongoing two-way dialogue with each organ continuously influencing the other's function. Research has shown that the heart communicates to the brain in four major ways: neurologically, through transmission of nerve impulses; biochemically, via hormones and neurotransmitters; biophysically, through pressure waves; and energetically, through electromagnetic field interactions. Communication along all these conduits significantly affects the brain's activity. And the heart is both the source of life and the source of cardiac arrhythmias and complications. Cardiovascular diseases are the leading cause of comorbidity and mortality all around the world. Cardiovascular system is regulated by the autonomic nervous system, which includes the sympathetic and parasympathetic nervous systems with emotions and feelings. Now, cardiovascular diseases are connected to subtle brain function changes and alterations in neurocognitive performance that assesses stroke and dementia. Stress events impact on both the heart and the brain, and lifestyle interventions may be beneficial on the diseases on the cardiovascular system and brain. Heart and brain have a dynamic relationship with a strong connection that includes a lot of different conditions. Cardiovascular diseases are the leading cause of morbidity and mortality, while cardiovascular system is regulated by all this autonomic nervous system we said earlier. Cardiovascular diseases are connected to subtle brain function changes and alterations in neurocognitive performance. And stressful events impact on both the heart and the brain, and lifestyle interventions are very beneficial because they have to do with the rehabilitation programs. So we said about cardiovascular diseases, but one therapeutic approach of cardiovascular disease is cardiac surgery. And cardiac surgery can unfortunately lead to cognitive decline because it affects the patient's ability to think, learn, remember, and make decisions. This not only impacts an individual's well-being, but has a result in comorbidity and higher healthcare costs because the patients stay longer in the hospital regarding other conditions. And what is the most important thing here? Post-operative cognitive function. When we have cardiac surgery procedures, we neuropsychologists and clinical psychologists play a very important role in the assessment of POCD because only neuropsychologists can detect POCD. And this is very important. Keep this in mind. So what is post-operative cognitive dysfunction? Is impairment in attention, recognition, cognition, orientation, memory, and learning following surgery. It impacts cognitive function and result in increased morbidity and prolonged hospitalization because the patients stay longer in the hospital, increased healthcare costs, you can understand that, and adverse impact on social functioning and quality of life because of the hospitalization, and the patients stay longer in the ICU department. So this is very important for you to know. Neuropsychometric tests are needed to detect and quantify subtle POCD, while its incidence depends on type of surgery, patient's age, method of detection, preoperative level of education, coexisting diseases. It's very important for us to know if there are coexisting diseases and preoperative cognitive performance. Now, we move on to coronary artery bypass grafting because the patients that we had, the majority of the patients that we had in the cardiothoracic department, when undergone this procedure. This is a surgical procedure treatment of coronary artery disease, provides complete revascularization, has low mortality rate, but there are many side effects such as permanent vascular cerebral stroke, systemic inflammation, renal and pulmonary complications, and all these have an adverse impact on cognitive functions. That's why neuropsychologists are surgery departments. So, cognitive reserve. Let's move to the protection. We said about the conditions that we have, but let's see the protection. Who is the protective factor and what is the protective factor here so that we can use it as neuropsychologists to protect our patients? This protective factor is called cognitive reserve. And cognitive reserve is the brain's ability to cope with damage, plays a key role in recovery because it is considered to be a buffer against the consequences of neuropathology, and assessments target this reserve so that the patients can be guided into specialized cognitive enhancement programs designed to improve post-surgery recovery and outcomes. So, cognitive reserve is a very important factor, but you need to know how to assess it and you need to know how to use these protective factors. And the only people who can do this is neuropsychologists, okay? And after a part of the treatment in the group, of course, clinical psychologists and counseling psychologists. Our research. This is Kalliopi University General Hospital. I contacted there. I did my degree there, my PhD, and my postdoctoral research there. And this is me working in the ICU department that belongs in the cardiothoracic department of Kalliopi Hospital. First, I will start with the awards that we receive from international conferences, national and international conferences and events. We received many prestigious awards, and we are very happy about this because our work, when we started our work, some years before, it was considered to be very innovative because not all departments could have from other countries in Europe, for example, could have a neuropsychologist who was working particularly in PD. So we are very happy about the awards that we received at national and international level. Now, the part of our research that has to do with coronary artery bypass grafting patients, we have many publications. This is the first publication that we had along with all the team. It's very important to cooperate, for us to cooperate with cardiothoracic because we are a team. We're a great team, and we are very proud and honored to be part of this team because this is not the work of only one person. We are talking about a team. And regarding the protective role of cognitive reserve, part of my postdoctoral research, I was happy and honored to publish it in 2023 with my supervisor, Professor Kosmidis, who is the president of Psychology at Aristotle University of Thessaloniki and President of International Neuropsychological Society. Now, our hypothesis, we examined whether patients undergoing coronary artery bypass grafting with the MEX system, the MEX system is the new technology that cardiac fractures developed in order to treat the patients. And we wanted to see if this system, the new one, the patients will exhibit post-operative cognitive decline to a lesser extent than patients undergoing coronary artery bypass grafting with the old system, with the conventional system. So we had the conventional system. All the coronary artery bypass grafting operations were conducting with the conventional, but we have the new technology, and that's for this reason I started working at cardiothoracic department, because cardiothoracic surgeons wanted to see the effects of the new technology on the patients. So we had a neurocognitive evaluation. We had 60 patients, 29 that were operated in one technology and 31 with the other technology. We tested them before surgery, prior to discharge. This means 1 week after surgery, and a 3-month follow-up. 3 to 4 months follow-up. We used alternative forms of tests, and we had an assessment of anxiety, depression, positive and negative mood, because emotions can play an important role affecting neuropsychological performance. And of course, we had an assessment of quality of life. This is this is a part of MEX systems. This is a new technology. It's called minimally invasive because it's considered to have minimal invasion in the body of the patient. Of course, a cardiothoracic surgeon will be better in explaining this in comparison with me, but this is the new technology. You see many tubes, but trust me, we have less tubes here regarding the previous, the conventional system. And this is the neurocognitive test battery that we have used. As you can see, we had an assessment. We assessed a broad variety of cognitive functions and emotions as well. And cognitive reserve was calculated based on the following data for each patient: number of years of education, professional level, premorbid ability estimate. We had some tests, neuropsychological tests, that can be used to assess premorbid level of functioning. Of course, functional level, everyday functional level of the clients, and involvement in recreational social activities. All these that I mentioned here play a very important role when it comes to cognitive reserve. And with all this, a score can be calculated, and the patients are divided in high cognitive reserve group or low cognitive reserve group. And I will mention only a few things about statistics. We used ANOVA mixed design. We didn't observe statistically significant differences between the two study groups in age and years of education. Any of the preoperative cognitive domains. Before surgery, they started almost from the same baseline. We didn't observe differences regarding mood, anxiety, and depression variables, and we didn't find any differences between the medical variables, like CBP time, number of grafts, intensive care unit stay, and hospital stay. These are very important variables regarding cardiothoracic surgeons. That's why I mention it here. The time of the operation plays a very important role. The number of grafts that a patient takes, you can understand it's not the same for a patient to undergo this procedure with 1 or 2 grafts and in comparison with other with 3 or 4 grafts. You can understand that. and post-operative cognitive function between the two study groups. Prior to discharge in the MEAC group, the new technology, we had 41%, but at 3-month follow-up, the 41% became 21%, decreased. And in the conventional group, in the old technology group, we had 65% prior to discharge, and 3 months after surgery, slightly increased, 41. You can see that the differences, the numbers are speaking, and we are talking about important differences here. And our conclusions regarding these groups of patients: the one group follow-up performance exceeded preoperative neurocognitive levels. This means that they exhibited less overall post-operative cognitive dysfunction, while the other group didn't reach preoperative neurocognitive levels immediately and 3 months after surgery. This means cognitive decline on most neuropsychological domains. And our findings suggest that the use of these systems may be beneficial for the neurocognitive outcome of the patients. In this point, I want to say that cardiothoracic surgeons, along with anesthesiologists and perfusionists, had some medical variables that tested. Regarding the medical variables I mentioned earlier, and they found differences as well, because I was the part of the neurocognitive evaluation. So cognitive stability plays a very important role when it comes to quality of life and daily activity, especially in heart surgery elderly patients. And regarding cognitive reserve, our results suggest that cognitive reserve can forecast neuropsychological outcomes of cardiac surgery patients, recognizing the patients with low cognitive reserve, help them to participate to intervention programs that could slow cognitive aging or reduce the dementia and enhance their overall post-surgical functional outcome. And this is very important for our patients. And now I'll mention a few things about left ventricular assist device, which is another very important procedure when it comes to cardiac surgery patients. We're talking about heart failure. Heart failure means that the cardiac output is insufficient to meet the needs of the body. And there is a condition called ischemic cardiomyopathy, which is a major cause of heart failure. We have dysfunction of the heart muscle and has previously been associated with neurocognitive deficits, among others. And when we have neurocognitive deficits, neuropsychologists are always present. So, left ventricular assist devices are used successfully in treating patients with this condition in two ways: as a bridge to transplant, which is very important. We're talking about a temporary condition, or as destination therapy. Destination therapy means permanent therapy. So we had an operation in Aheba Hospital, LVAD with stem cells, which was considered to be worldwide innovation in heart surgery. This was conducted at the Department of Cardiothoracic Surgery at the University of Thessaloniki. And this procedure in end-stage ischemic heart failure enhances myocardial reperfusion. This is a very important procedure. We're talking about two procedures together. And this is these are the LVADs. We are talking about pieces of I will use a general term, batteries that are implanted into the heart of the patients, and externally the patient has to carry the batteries with them. Of course, you can understand that all the system must be fully charged in order for the heart to beat. And this is a photograph from the surgery. The stem cells intramyocardially injected into the heart, and this was a very innovative operation. And we had the patient treated with these techniques. 64-year-old with 9 years of education, married with 2 adult children, worked as an accountant in private sector, but he was retired when the operation was conducted. This patient had end-stage ischemic cardiomyopathy, undergoing 2 procedures. Without this procedure, this patient would have died without these procedures. And we followed this patient over the course of 1 year after surgery to determine potential for improvement in condition, and underwent a comprehensive neuropsychological assessment. I had counseling sessions with the patient and the family members, and of course we had evaluation of his emotion and quality of life. This is the neurocognitive test battery that we have used. As you can see, it's very thorough and comprehensive, and we assessed emotions and quality of life as well, because quality of life is a very important aspect when it comes to cardiac surgery patients. Cognitive decline was defined as a decrease of 1 standard deviation or more in performance on 1 or more of the neuropsychological tests relative to Greek normative data of individuals in the same age group and educational level as the patient, and compare the performance of the same patient and 4 time points. The patient's performance was in the average range with no evidence of decline on the 3 follow-up evaluations on executive functions, visual spatial perception, visual organization, attention, picture naming, working memory, mood scales, and quality of life. Post-operative cognitive decline at 1 and 6 months after surgery of this patient reversed over time. Overall, we had improvements from follow-up at 1 month to follow-up at 6 months occurred on 50% of the variables examined. The patient's performance returned to the average and high average rates 12 months after surgery. The recommendations that we gave, we included this patient to a neurocognitive rehabilitation program focused on specific difficulties to develop new strategies for daily activities, and we increased the activities regarding cognitive reserve in order for the cognitive reserve to be enhanced. We had psychoeducation for a patient and family, management of negative emotions regarding device noise, because usually during the first days, the patient said that I cannot sleep because I hear my own heart, and it's like an old refrigerator making loud noises. And we had some sessions in order to manage these emotions, negative emotions, and psychological counseling for patient and the family together or separately. And emotions can overwhelm our brains, our hearts, and our bodies. It's obvious when we are talking about heart surgery and heart surgery procedures. They travel our emotional highway between our hearts and our minds, and management of negative emotions, enhancement of positive emotions, and increasing cognitive reserve. It's the key points here when we speak about cardiac surgery patients. And the important key points here, along with the neurocognitive and neuropsychological assessment, it's good to have counseling sessions before surgery and concurrent session with patients and the family members, because counseling can facilitate neuropsychological assessment and can increase cognitive reserve along with neurocognitive rehabilitation program, of course. And all these things are very important regarding our clients, our patients. And of course, we don't forget psychologists and neuropsychologists' contribution. We have a very important role when it comes to cardiothoracic patients. We have important role. We can have important role everywhere. But when it comes to cardiothoracic patients, our role is very important in order to facilitate the procedure, not only to help with the neuropsychological assessment, but to help with the counseling sessions that we have, with the management of negative emotions, because negative emotions can impact the heart. So we can protect the negative emotions, the adverse emotions of the heart procedure by the management of negative emotions, increasing positive emotions, and of course with cognitive reserve that is considered to be a neuroprotective factor as well. And I want to conclude by rephrasing what Alan Badley had told about memory, but by saying the best way to appreciate the importance of cognitive system is to consider what it would be like to live without it. And cognitive system is not a single organ like the heart or liver, but an alliance of systems that work together, allowing us to learn from the past and predict the future. Imagine what we will be without our cognitive system. Is it important for us to survive? Of course. Can we survive if we don't have the cognitive functions intact? So, thank you for your attention. I will be happy to respond to your comments, to your questions, whatever you want. And this is my email. You can contact me. I will be happy to share my applications with you.
Excellent. Thank you so, so much. That was a really wonderful talk, really, really interesting. Just to remind people in the audience, if you have any questions, please type them in the Q&A box and then we'll get to them. There's already a first question to start with. This question is as follows. After 2.5 years since my open heart surgery, I still have short-term memory problems. Could you please suggest any approach which will help me to continue to improve?
Alison, I hope you will be better. Yes, I can understand that. As I mentioned in my presentation, there are some cognitive problems, but these problems, after some years, they will be decreased. So I would say, but of course, you need to be in a rehab, neurocognitive rehab. You need to be a neurocognitive rehab program in order for your cognitive reserve to be enhanced. So I would suggest you to go and see if there are people who are specialized, neuropsychologists I mean, who are specialized in this procedure with heart surgery patients. Of course, counseling could be will be important for you because facilitates the procedure and helps you with the management of your negative emotions. But if you don't find anything, you can contact me. You can contact me and have some sessions with me. I will be happy to see you and speak with you.
That's very kind of you. So if there are any other questions, please do pop them in the Q&A. I was just curious, you mentioned interventions a few times, that it's important also to know about cognitive reserve to maybe better organize those interventions. Can you say a little bit more about what you mean by interventions or what kind of things concretely you have in mind?
When we say interventions regarding neuropsychologists, we are talking about rehabilitation programs. Rehabilitation programs consist of counseling, consist of some exercises, cognitive exercises. Now we have computerized exercises. It doesn't have to do only with young patients. Elderly patients can attend these programs because the instructions are you can press a button if you see a red star, for example. Counseling is very important regarding intervention, the management, or even psychotherapy, the management of negative emotions, and of course, the way that we enhance cognitive reserve. And how can we enhance cognitive reserve? We can enhance by cognitive exercises. Cognitive exercises are very important. Recreational activities are very important because the questions that we have in order to measure cognitive reserve, we ask questions about if our clients or patients go to the bank. and can deal money, if they go to the theater, if they go to the cinema, if they go to the supermarket in order to shop. So whatever is considered to be a cognitive exercise, there are in our cell phones we have many exercise that can be considered as cognitive exercise and memory exercises. So interventions are all these. Because I said earlier that united we stand, divided we fall. It's very important to cooperate. We are talking about a team, not a single person who does all this, but we are talking about a team. Interdisciplinary teams are very important. So when I say interventions, I usually say rehabilitation. So neurocognitive rehab is very important when it comes to cardiothoracic surgery patients.
Good. Yeah, that emphasis on team, I really like that. We've got another question from the audience. Do you have any future research planned in this area?
Yes, I have some results. The research is ongoing. We wanted to see other things. One of my favorite topics in approach in psychology is positive psychology. And our future research will show how positive emotions are involved in the procedure, because we say that we have negative emotions, we need to manage our negative emotions. Cardiothoracic surgery patients are overwhelmed by the negative emotions, because you can understand we are talking about a life-threatening procedure. We are talking about a major operation technique. A part of the protocol of a HEPA hospital is every patient who undergone this procedure stays at the ICU for 2 days. It's mandatory to stay in the ICU, whether they face major problems or not. It's a part of the protocol. When they finish the surgery, they enter in ICU department in order to be treated and check their vital signs, and I even enter the ICU in order to make assessment to the client. So it's very important when the client returns back to the department, cardiothoracic surgery department, to start the interventions that you can use, the physician's intervention and our intervention. And of course, positive psychology approach is very important regarding this direction to see. We say positive emotions. We want to see in detail which emotions can play a very important role and how can we enhance these emotions in order for the cognitive reserve to be enhanced.
Really interesting, thank you. We've got another question. Do you think this research could be applied to other surgeries or treatments, for example, to cancer treatments?
This is a very interesting question. Because a part of my research has to do with cancer patients. So it's very important, but because there are many types of cancer, we need to see which ones. And we need to see the duration of the surgery is very important, and what other treatments, because when it comes to cancer we don't have only surgical procedures, but this could be very important, because the thing that I didn't mention in my presentation for the sake of time, and I kept it for the conversation, is that cognitive reserve is not so well researched in cardiothoracic surgical patients. It was only one poster presentation, if I remember correctly, and my research. I couldn't find any research when I started my PhD and my postdoctoral, after my PhD, my postdoctoral research, I couldn't find any research in order to write the theoretical background. And the only research I could find is regarding dementia, because cognitive reserve is well researched and well investigated in dementia patients. And in other conditions that can impact cognition, HIV patients, frontotemporal dementia, any types of dementia, Alzheimer's dementia. So in cardiothoracic surgery, it's considered to be innovative, because not many people research this in this approach. But it would be very interesting to see this approach and these interventions in cancer patients. This could be very interesting. You give us ideas. Thank you very much for your ideas that you give me for future research. I will be happy to research this.
Excellent, giving you a lot of suggestions already. Can I just ask it in that respect, because you were saying that when you started this, there was basically not much to base your research on. Where do you hope that you and the field will be standing in 10, 20 years from now? What are your bigger goals in this work?
Oh, I love your question. Well, I could use the phrase, I have a dream, My dream is, as a neuropsychologist, I have a dream. My dream is that neuropsychologists start expanding more in Greece, in Europe, and the rest of the world. In the US, it's only well developed. I would say that my dream is the presence of a neuropsychologist and psychologist in a clinical psychologist to be mandatory for departments of cardiothoracic surgery, because it's very important for this population. And in cancer patients, I wouldn't say less about cancer patients, to be mandatory, because in Greece the situation is that there are one or two psychologists for all the patients of the hospital. If they work in a hospital, they have to make sessions and appointments with the rest of the patients, not only in one department or two. So you can understand that they don't have the time. Always you have too much work, too many things to do. You don't have the time. So my goal will be this. I will work towards this direction. I will be ambassador regarding my profession. And of course, we as academics, with our research, we educate our students in order to be in the field, to work, to continue our work. This is another dream of mine, in order to educate my students to continue my work, perhaps, and go there and see clients, make counseling sessions, conduct counseling sessions and all this, in order to treat the patients. This is very important. And it's very important, the team is very important for me. I believe in teams. The team is very important for me. Professor Anastasiadis, I could say that Professor Anastasiadis is the head now of cardiothoracic department and the president of the medical school of Aristotle University of Thessaloniki. Was the president when I did my PhD. He was part of the committee, one of my supervisors. So I was very happy and honored because he trusted me. He said, I believe in you. We will do this together. We want to treat our clients in the best way. So I trust you. We will be together. So I'm very honored by his trust, and all the team embrace me in a better way, because it's very difficult to work with, in this department, to work with cardiothoracic surgery patients. So it's a teamwork. It's a great team's work. So we are many people who work together in order for the clients, for the patients, to have an optimal effect on their treatment. So this is very important.
Sounds like a really important dream, and I hope you can make that happen with the team members you work with. You mentioned that things are a little bit different, for example, in the US. I know you're involved in a lot of European and international societies. What have been your experiences across countries in terms of how neuropsychology is involved or not?
Sorry, I couldn't hear you. The last sentence, can you repeat the last sentence?
I was just curious what your experiences are and whether this varies across countries and how neuropsychology and neuropsychological assessments are involved, for example, in patients with cancer or with other diseases.
Yes, I have many colleagues from the US. Usually, I don't have colleagues who work with cardiothoracic surgery patients. So my professor, my supervisor, Professor Kosmidis, was at a conference and found someone who started working in this department and gave his email shared his email with me. But we couldn't find any colleagues working in departments like that. I have colleagues who work with cancer patients and, of course, with neurological patients, because it's considered to be common a neuropsychologist to cooperate with a neurologist for neurological patients. So not many people are working in this field. That's why it's considered to be innovative. For Greece, it's 100% innovative. And for some countries in Europe, when I go to conferences, I always try to find people who work in these departments or want to start something in this department. But my colleagues from the US usually work with neurology, COVID-19 patients as well. So I have worked with cancer patients, children as well, children with disabilities, vulnerable population like prisoners, because I am a clinical psychologist as well, not only a neuropsychologist. So I embrace diversity and neurodiversity in general. But usually when I speak with my colleagues, we focus on the neurological part of some conditions, but not, I couldn't find people who work with cardiac surgery patients.
Yeah,
But I
really.
hope in the future I will find.
So I was going to say that let's hope that you can get more of those connections and more people who start working on this. I'll just ask people if you have any other questions. We've already had some excellent questions, and please do leave them in the Q&A for us. I'll just ask you one final question, and then we'll see if there's more from the audience. I can imagine this work must be really challenging in so many different ways. Can you say maybe a little bit more about what you've found to be some of the biggest challenges?
I love your questions today, Angela. Yes, I always want to share this, and I always like to talk about this research. Cardiothoracic surgical department is a department with many severe cases. The clients have life-threatening conditions, because we are talking about heart surgery, and in this situation, you must work and move very quickly in order to, that's why Professor Anastasiadis is always working very quickly in order to facilitate the procedure. And when we speak about our research, because he was one of my supervisors, when I say something, say immediately, yes, do it, without any second thoughts. You must move very quickly. The challenges are that you have, because it's part of our work, to deal with the negative emotions of the clients. The patients are overwhelmed by the negative emotions. Sometimes they will be angry towards you. Sometimes they will be angry towards everyone. The surgical team, the medical team, the nurses, and you need to deal with all this. And in order to conduct a neuropsychological assessment, you need to have to first to deal with the negative emotions. Otherwise, you cannot have valid results. When someone is very angry, when someone is very sad, this impacts neuropsychological assessment and the profile of the patient. So the most challenging is that you have to deal with all this very quickly. You have to deal with family members. The family members are overwhelmed by all this. They are in a hospital, they don't know many things. They try to ask nurses and things like that, and physicians about the psychological part, but they are not psychologists, and they need treatment as well. I have many sessions with the family. And another thing that is important is that not many people know the importance of neuropsychological assessment in cardiac surgery. That's why, because it's considered to be something not common. So not many people know this, have this information, that it's a very important. That's why I said it could be mandatory, like they had the testing, the blood testing, the electrocardiography that they have. It could be neuropsychological assessment. This should be the case. So for now, not many patients and not many physicians, of course, in other departments know that it's very important to conduct all this. And sometimes because they don't know the importance of your work, sometimes you face issues like that sometimes you don't have an office, you need to wait for an office because too many people want to see the same patients. So you need to solve all the practical things, to find an office, to see which clients are ready for neuropsychological assessment and sessions, because in this clinic they have nursing issues, they have other treatments that patients must undergo, and you need to face all this, to face the negative emotions of the patient, of the family members, and sometimes you have to face the challenges that physicians bring, because some physicians don't know about your work. Of course, I made some presentations when I was there. I was a research fellow for many years, and I made some presentations, and all medical staff attended my presentations in order to present myself and to say, who am I and what am I doing here? So it was very important to present my work in order for them to understand, because neuropsychology is not a part of the medical education for cardiac surgeons. You can understand that. And besides the team of Professor Anastasiadis, who knew everything about me, the other surgeons didn't know about me. So this could be challenging as well, because sometimes they don't know your work. They think that you conduct psychotherapeutic treatment. And I said that this is not the main goal. We do this, but the main goal is to see the brain, to see neuropsychological part. So I would say these are the challenges, but we have many positive. That's why it's a rewarding experiences.
Absolutely. And it sounds like you've overcome a lot of these challenges, and just listening to your future dreams for the next 10 years, I'm sure you're going to do a lot of really good and important things. I think on that note, I want to thank you so much for taking the time to share your work and to share your insights with us today. Your email address has already been left in the chat, so people who do want to follow up with you afterwards, they can do so via email. So thank you so much, and thank you also to everyone for attending today. So this has been recorded, so you'll be able to re-watch it via the YouTube channel of the York Festival of Ideas, and you'll get an email when the recording is available. I think we're only really at the start of the festival, so we've got another about 2 weeks of a lot of other really interesting events going on. So we hope to see you there. But thank you so much for joining, and thank you again, Kalliopi, for your really interesting talk today.